by Dr. Sriram, arranged by Lakshmi Giri Charitable Trust. So even before I speak and welcome Dr. Sriram, I just want to say a few words about our trust. Giri Trading Agency Private Limited is nearing its 75th year, and it has been our long cherished dream to have a trust in the name of our mother Lakshmi Giri, and that is how more than a decade ago we started this Lakshmi Giri Charitable Trust, mainly to promote, support, encourage anything that is to cater to Sanatana Dharma, anything that will promote and propagate our culture and tradition, our Samskriti. In that way, we have always, all these years, we have been promoting young talents, starting from my brother-in-law Srinivasan, who's here. He started it with the main idea to promote young talents and catch them young and give them a lot of opportunities. And that's how we started the entire journey. And in the journey, after Mrs. Sharda Prakash took over it as its managing trustee, we are now looking into various other multivarious activities like Veda Patashalas, Vedic studies, promoting not unheard of temples, go and give our puja packs, and to promote our culture in every way, possible way. So in that connection, we also feel that health is a very, very important aspect in our life. And there's so much that has been told in our Shastras as to how it has to be held, the mind over the body. It's just not about being healthy, it's about how you keep your mind and body and soul in one place. And if you take care of your health every day, 2 hours, the body takes care of you for the rest of the year. So in that context, we're very, very happy Dr. Sriram is here, and he's going to give us a talk. What very impressed me was his mission, in which he says that he wants to give high quality clinical heart care with dignity and compassion, meeting physical and emotional needs of our patients, which is something very, very beautiful, because that's what finally it amounts to. However we are healthy, but finally it's our thoughts and how we keep ourselves peaceful at our heart, which will prevent our heart attack. So I'm so glad Dr. Sriram is here to give us multiple insights into how we need to look at our heart. So we heartily welcome you, sir, and give your insightful presentation.
So nice to have you all here on a Monday afternoon, 3 p.m. I'm really honored to be here. Thank you, Sharda Madam, to giving me an opportunity to address, and Srinivasan sir, thank you. I mean, it is very counterintuitive, because you normally talk about how to get patients into your clinic, but I'm going to tell you how to avoid us in the first place. But we'll take good care of you once if this you cross that threshold. So the emphasis of today's talk is what can we do to keep our heart healthy. Heart is an amazing organ. Heart is the size of a fist. You all know that. You have read that in high school. It's exactly in the center of the chest. Do you know how many times the heart squeezes and relaxes in one day? Can anybody take a guess, a wild guess? 100,000 times, 100 times the heart squeezes and relaxes. This is one cycle. 100,000 times the heart contracts. Can you imagine? A heart is, after all, an engine. It's a pump. And every squeeze of the heart, 70 milliliters of blood is ejected out. You do the math. 70 times 1 lakh is 70 lakhs of ml. That is 7,000 liters of blood circulates and it pumps the heart. The heart does that in one day. Times 365, times, say, somebody lives up to the 90, you do the math. I mean, even the computer will freeze. So that is what the heart does. And we take it for granted, don't we? We take it for granted. And we need to take a better care of the heart for it to function well. And it's after all an engine, right? A pump. Can you imagine a pump that lasts for 80, 90 years? Suppose I go to a store, I say I want a well pump to last 80 years. He'll laugh at me and say, you're gone crazy, and see how efficient our heart is. So we need to take all precautions to keep it going. So that's my aim of the talk today. So before we do that, we all have iPhones or smartphones. You download an app called ASCVD Risk Estimator. You can make a note of that. You download that app and you can put in your all personal details, which is age, sex, family history, diabetes, blood pressure, cholesterol, and few other questions. And it will give you an estimate what is your risk for the next 10 years of getting a heart attack. It is an estimate. It cannot be, and it's a fairly good estimate. So you need to ask yourself, what is my risk? Okay, each person's risk is different. Some are low risk, some are very high risk, some are intermediate risk. So my talk is predominantly geared to somebody who is in medium to high risk. Okay, other important point, heart disease, which is nothing but the arteries close up because of deposition of fat and cholesterol. It starts at the age of 20 to 30 years old. We all assume heart disease is a disease of the elderly, somebody who is 60, 50, 70. But we all know by scientific data and autopsy data, this starts at the age of 20 to 30. We start developing rough edges, cholesterol buildup even at the age of 20 to 30. So the artery is so forgiving, it takes another 20 to 30 to 40 years to develop more and more blockage, and eventually it closes. So the emphasis is that we need to start whatever we are going to talk today at a very early age, at the age of 20s to 30s. So high school kids should know what I'm going to talk today. Unfortunately, everybody is above 60. But better late than never. But the point is, you need to carry some messages to your children and grandchildren, so that they can prevent heart disease. So the first point is, this is very important app, okay? So I'm going to give you all the practical hints. If it is high risk, it's more than 20% in the next 10 years. Low risk, less than 5% in the next 10 years. Intermediate risk is between 5 and 20. Okay? So you can do your own risk assessment even as you listen to my talk. So what are the risk factors? Risk factor is who's more prone to have heart disease. Let's start with that. Unfortunately, we South Asians, that is people from India, Pakistan, Bangladesh, Sri Lanka, have 3 times to 4 times more risk of developing heart disease compared to other groups. We don't know why. We have a very high genetic predisposition to develop blockages, atherosclerosis, which is a medical word, hardening of the arteries. So that is, we are all at a risk. We are all South Asians, right? So then the second thing you have to ask yourself is there anybody in your family below the age of 55 who have had heart disease? It could be a brother, it could be a sister, it could be your first cousin, uncles, who have died unexpectedly or have a heart disease, a heart attack before the age of 55. That's a risk factor. Family history is very important. Next is age. I told you it starts at an young age, but most of it is silent. But as we progress in age, because we didn't take good care of ourselves in our 20s and 30s, we are more prone to develop heart attacks and heart failure and heart disease as we age. So older you are, the more likely you're like to develop this. Next is high blood pressure. High blood pressure causes hardening of the arteries. It stresses the heart. The pressure is high, the heart has to pump against higher pressure. Heart has to stress, it requires more of fuel. Fuel is oxygen, is more demand. So we need to, I'm going to come back to what's the right blood pressure to attain. Diabetes, it is epidemic among Asians, South Asians. Almost 60-70% of us have some kind of diabetes, which is high glucose level. We are not able to metabolize sugar. Okay, lack of insulin. The insulin is resistant to work at the cellular level. So diabetes is a very important risk factor. Next is smoking. Hopefully nobody smokes here. Smoking has come down, but I see a lot of youngsters smoke. I still see it, and that's very unfortunate. It had come down, now it's going up. Smoking in form of e-cigarettes and regulars is equally bad. Next is kidney disease. People who have kidney failure they are more prone to develop heart disease. Next is premature menopause. Generally, females have about 10 years of risk-free. Females are less prone to have heart disease till they attain menopause. After menopause, the male and female risk almost equalization. But some females develop a premature menopause for various reasons, and they are more at risk. We don't know why. There are so many theories. Then any kind of inflammatory problem like arthritis, not regular type of arthritis we all have with age, but there's a condition called rheumatoid arthritis, an autoimmune type of arthritis. It is a lot of inflammation in the joints. They are more prone for heart disease. Then people with a high cholesterol. One number you have to remember is, one type of cholesterol you have to remember is LDL, low density lipoprotein. Because if you go to the lab, you will get 6 or 7 types of cholesterol. It's very confusing. I want to make life easy for you. Just remember LDL. If LDL is above 160, the risk is very high. I'll tell you what are the ideal numbers, okay, in a second. Same thing with triglyceride. It's a form of fat. If it's more than 175, you're at a risk. And a few other things that you may not remember, but not important to remember, is lipoprotein small a, more than 50, and C-reactive protein. I'll just skip that because it gets complicated. But this is a complete risk profile. You have to ask yourself, do I have any of this? It is somehow captured in that app I'm talking about. Heart attack, heart disease. Heart attack is an end result of a blockage in the artery. That's a good question. I'll give you a diagram.
Is heart attack a heart disease? Is it a generic word?
See, this is the artery, okay? And this is a plaque or the blockage, okay? This develops over the years. Some of us have a plaque that is high in fat, and that ruptures, and it causes blockage, okay? So there is no blood flow, the muscle dies. When the muscle dies, that's heart attack. Heart disease is more a general terminology. Heart attack is a specific form of heart disease. I kind of use it interchangeably, which is not totally correct. A heart disease can be valve disease, muscle disease, and other kinds of diseases.
That's precisely the reason I asked, because I find it confusing when people use these words interchangeably. So I don't know what.
Heart attack is a manifestation of heart disease.
Okay.
Is a manifestation of heart disease.
It's a form of heart.
Yes.
Okay.
So as far as blood pressure goes, the ideal blood pressure to attain is 120 over 90, 80 to 90. It should not exceed 120 based on definition of the American Heart Association and European Heart Association. Very strict definition. If it is more than 140 over 90 on two separate occasions at a baseline state, not when you're angry or when you're stressed or when you're exercising or somebody gives you a hard time. So when you're at a baseline state, if it's more than 140 over 90, you have hypertension. Hypertension is a risk factor for heart disease / heart attack. You need to keep your blood pressure below 140, ideally 120 over 90. Hypertension does not cause any symptoms. We all think you should have symptoms if you have high blood pressure. Not so. It's a silent killer. It's literally a killer. It can cause heart attacks, it can cause strokes, it can cause kidney failure, among other things. So this can progress for years before it manifests as a complication of one of the three. So it's very important. This is why I brought this. Everybody should invest, not necessarily this brand, but a blood pressure monitor. I'm not selling any, because a blood pressure monitor. Because you need to know your blood pressure like you know your PIN code. Literally. Now, at the same time, you don't have to check your blood pressure every day. When you're starting off, you can check it twice or thrice a week, then once a week, and maybe once a month if it's under control. I mean, you don't have to be compulsive about it, but you have to know what's your blood pressure. If it is more than 140 over 90, you definitely need treatment. I'm not going to go into treatment because it's a 1 hour subject. I don't want to bore you with that. You need to go to your doctor for that. Next comes diabetes. We should all know our A1C, just like you know your phone number and zip code. Somebody says, I don't know what my PIN code is, that means there's something. You have to know one A1C. It has to be less than 7, ideally 6.5. Okay, remember this number. Then comes the LDL, low density lipoprotein. Take it from me, it should be less than 100. Especially we South Asians, we are at a risk. Many of us have diabetes, many of us have hypertension. We have all the risk factors, and we should know our LDL. Again, it is a silent disease. High cholesterol is a silent disease till it is too late when it manifests as a heart attack. So everybody should know what their LDL, and it should be less than 100. Please remember, easy to remember, 100. And people who have heart disease, some of us have had stents, bypass surgery. They're at a very high risk to develop another heart attack because they already have the problem. So these patients should have a LDL of 55 or below. These are all numbers that I'm not making it up. This is all based on guidelines which came out last year. Did you get that? Blood pressure 120/90, A1C 6.5, cholesterol LDL less than 100, somebody with heart disease less than 55. 30 minutes every day. of moderate exercise. Ideally, 8 to 10,000 steps a day. With the traffic and with the, where do we get this? It's very hard to exercise 30 minutes. We can probably do 30 minutes at home, but where do you get 8 to 10,000 steps? Yeah, he does, with the risk of, I know, but I'm talking in general. So it's wise to invest in something doable at home, like a treadmill. I'm a strong advocate of buying a quality treadmill, putting it in your space at home. And you would have spent a ton of money, you would, at least for that, you will use it. And I'll tell you, exercise is the best preventive medicine. It keeps your blood pressure low, keeps your heart in tip-top shape, and if you have any symptoms, you manifest it. If you're sitting all day and you're not stressing your heart, you won't know what's happening. So invest in a treadmill. Then diet. Only 2 diets have been shown by scientific means. Mediterranean diet and DASH diet, which prevents heart disease or reduces the chance, which involves olive oil, almonds. Of course, many of us don't eat fish, and avoid red meat, lot of vegetables, okay? And also vegetables should not overcook it. Just enough to eat it partially cooked. That way it retains all the nutrients. Otherwise, all the nutrients get washed away in the water. Sometimes we have a tendency to keep on boiling vegetables. And the sodium intake. We are all at a fault of eating a lot of high salt diet. Salt causes hypertension. Not causes, it makes hypertension difficult to control. So sodium intake should be restricted, more fruit and vegetable, nuts, especially almonds, and olive oil. Now, question comes up about coconut oil and all that. Very controversial, I think it is neutral. It used to have a very bad press, coconut is bad. Of late, they have said it is not as bad as it was, like palm oil. I'm not an expert in diet, so I'm not going to venture into it and give you an opinion, except you need to do your own research about coconut, and because we use a lot of coconut in our.
There was a time when sunflower oil was propagated.
Yes. Sunflower oil is good, canola, yeah. So, the diet and heart disease is so controversial. Every year something new comes up. So I don't know on what basis these opinions are formed. As a clinician, I'm not able to get to the bottom of this. So you have to do your own research at your own risk. But again, olive oil is proven to be good. I don't know how much olive oil we use in our cooking. Not much, I think. Because the heat, it doesn't stand heat, it gets
Some studies show that insulin is more dangerous than cholesterol. What is your opinion?
What's that?
Insulin resistance is more dangerous than the cholesterol.
Yes, diabetes. You're talking about diabetes.
So, which one will you gain more, sir?
Both.
Cholesterol or a person with insulin resistance. Is insulin resistance the root cause or the cholesterol?
There's no root cause. Heart attacks are caused by multiple factors, right? You cannot differentiate one from, both are equally bad. Answer to your question.
Yeah. Some people, studies, just a reference, people say that cholesterol is not the issue.
No. I know what you're saying. There's a lot of controversy. Do you really have to take drugs to bring your cholesterol down? It has been proven beyond doubt. Higher the cholesterol, the more risk of heart attacks. No question about it. There is a lot of press that you can avoid taking, don't worry about cholesterol. That is, to me, it is not scientific data.
Some people say LDL, I mean, ignore LDL.
Oh,
and
no.
ratio
I think he's
between
giving, that person is
HDL
giving.
and triglycerides is of more.
Both are LDL and high triglyceride, both are atherogenic, meaning it causes hardening. LDL is more than triglyceride because it causes inflammation on the inner lining of the coronary arteries. When there is inflammation, the platelets get sticky and the fat gets deposited. So over the years, like an old rusty pipe, it gets narrow and narrow and eventually it closes. So the lower the LDL, lower the risk of heart attack and heart disease. No question about it. Okay, how do you keep your LDL below 100? Again, diet. You have to control the fat intake and cholesterol intake in your food, like eating egg yolk, cut it down, you better avoid eggs and red meat, As you know, meat consumption is very high outside Mylapore. So outside Mylapore, very high meat intake, right? So I'm not, I shouldn't be talking to this audience about meat. To keep your LDLs low, especially if it is more than one risk factor like diabetes, hypertension, family history, prior heart attacks, prior heart surgery, you need to be on a statin. Statin, there are 2 or 3 kinds of statins. I don't want to go into the name. Statins is a group of medication which acts in the liver to prevent manufacture of cholesterol. So the cholesterol level comes down. When cholesterol level comes down, the LDL, which is the bad cholesterol, also comes down. Okay? And if some people develop muscle aches with statin, 10 to 15% of people develop muscle aches. For them, you have to use a new class of drug called PCKS inhibitors. Don't worry about it. There are drugs that can reduce your cholesterol without statins. But 5 to 10% of patients do not tolerate statin. So if you already have heart disease, I told you before, people who have had heart attacks, bypass surgery, stent, your LDL should be less than 55. This is what I tell my patients, 55. Okay? So what are the symptoms of heart? In spite of all this, you have to be aware of your symptoms because you need to go to your doctor with the earliest onset of symptoms. Earlier you go, quicker the management is, lower the risk because you get the right treatment. Chest pain. Chest pain is a discomfort in the middle of the chest, like a heaviness, tightness, like somebody pressing you. More so when you walk, rest. When you rest, it goes away. It can happen mostly in the mornings. It can happen after a meal. It can happen when you're stressed out at work or you're angry with somebody, you develop chest pain because your blood pressure goes up, your heart has to work harder, there is a blockage and there is less oxygen going to the heart muscle and the muscle cries out with pain, releasing substances, pain. So body has a defense mechanism. Something is not right. So listen to your body. If something is not right, the body is telling there's a red flag. Don't ignore chest pain. Not everybody complains of pain. They can say it is discomfort. Something is happening. You should know your body. Something is happening in the chest. Think of heart disease. Heart attack or symptoms leading to heart attack. Shortness of breath, out of breath. You can walk 2 flights of stairs till yesterday, and for the last week and you started having shortness of breath recently. You're playing tennis, you used to play 3 sets of tennis, and now within the first set itself, you're out of breath. Think of heart disease. Sweating, of course, sweating is so common in Chennai, except in the month of January and February, but you will start sweating very soon. But not all sweating leads to a heart attack, but unusual sweating. If you are comfortable and I am sweating, there is something wrong. It is the body's manifestation of stress. It's a manifestation of heart attack or heart disease. Same thing with dizziness and passing out, syncope, left arm pain. Like somebody put a band around your chest. Don't hesitate to see the doctor. We are all very shy to go to a doctor because you don't want to make a fuss. You don't want to upset your family, worry your family. So, that's our, you don't want to draw attention, right? These are some of the hurdles of going and seeking medical attention. So if all this happens, it's okay, and go and see a doctor. At least he will do a basic check and clear you, or do the necessary tests. But very often we feel shy to go to the doctor. Please don't, because the longer you wait, bigger the complication. Now the next important is a plan of action. What happens, say at 2 a.m., you wake up, you have chest pain. You cannot go back to sleep. Something is bothering you. You think something is drastically going wrong. What do you do? What do you do? You're worried that it may be heart attack. Your spouse is sleeping. Do you wake him or wake her up? Or you wake your son? Or if you're all alone, do you call a neighbor? If in doubt, you have to go to the emergency room. But the key is to go to the right hospital. Don't go to an orthopedic hospital when you're having a heart attack. It's a waste of time. So you need to plan ahead. We as friends and community, what do we do? Which is the nearest place which is specific for heart attacks?
Call for an ambulance.
Call for an ambulance. What ambulance to call? Which hospital you're going to go? You have to plan this way ahead and keep it in your, stick it on a fridge. Because at that time you will not think. So you should have a mock drill. Where do I go? So you have to go to that particular hospital, talk to the doctors there. What is the process to get emergency care? Are you equipped to deal with heart attacks? Not all hospitals are equipped with heart attacks. Heart attacks are dealt by doing an emergency angioplasty, opening up a blocked artery, or giving a medicine to dissolve the clot. Because time is muscle. When the heart attack happens, the muscle is dying, clock is ticking. The golden hour is the 90 minutes. Sooner you go, the quicker you can open the artery and save the muscle. The longer you wait, more muscle damage, more chance of heart damage, more chance of dying. More deaths happen in the first hour of heart attack than any other time. So you need to have a plan where to go if this happens. We can all pray it doesn't happen. If it happens, what do you do? So we as a community should all sit together and share information. And if you are living in a flat, about 30 families, I'm sure you all have associations. One of the topic is, if one of us falls sick, especially heart attack or any dire emergency, where do we go? Who do we call? If the ambulance is not coming, which neighbor is going to volunteer to take by car? Not everybody has a car, right? So all this, because if you don't do this, you will get stuck. So what are the tests to do? If you are a high risk and you're worried that something is not right, go and see a doctor. You don't have to go to a cardiologist. Go to a general physician. He is good, competent to do some basic tests. And if need be, he will refer to a cardiologist. and go to your family doctor. He knows you. You know, don't ask for a specific specialist in specific hospital. Time is lost. But in this situation, I'm talking more about something that is worrying you, not an emergency. So normally what they do is they'll do an ECG, they'll do a stress test, they'll run your blood test, cholesterol, blood count, A1C. And there's one thing very important called coronary calcium. If you are high risk based on your app, what I recommend, and many of us recommend, it is not in official guideline because of the cost consideration. You need to do what is called as coronary calcium, which is a CT scan of the heart without a dye to see if there is any calcium in the coronary arteries. And they give a score, how dense the calcium is. If it is 0, that's the best news. That means you're going to live forever. You know, I'm exaggerating, you know, but your risk is low. If it is more than 400, red flag, multiple red flags, more than 400. Between 100 to 400, one red flag, but more than 400, multiple red flags, okay? So you can request your primary physician to order a coronary calcium score. Not everybody is in tune with that, but you may gently and cautiously and politely suggest to your doctor, can I do a coronary calcium, which is done everywhere now.
It is very different to CT scan?
Yeah. No, it is a CT scan, but no dye is put. If the stress test is positive, you do what is called as CT angio, where your dye is put and the arteries roadmap are got to see if there are any blockages. Or they do a catheterization. I didn't get into that. That is only needed if you're having a heart attack or having chest pain severe at rest, or if the stress test is positive. Not everybody should have a CT angiogram. Only if it is high risk of suspicion of a blockage. But coronary CT scan, which is done without a dye, can be done generally in high risk patients who don't to see what to do next. No, it has no value. Once you have a heart disease, I mean bypass surgery, it doesn't matter. It is already there. You don't need. It is only for people who don't have heart disease, and you are worried, do you have heart disease or not? Because you have diabetes, you have family history, your LDL is 150, 160, you don't have pain, and you're worried. What do I do next? You can probably do a stress test, but more importantly, if you do coronary calcium, you have an added data to take the next step. So I'll stop here with two important things. All of us, it may be a very big statement, but take it with a pinch of salt. All of us should know CPR. Just like all of us should know, I mean, driving is essential, you know. CPR, basic CPR, if your friend is dying, your colleague is dying, at least you can give him some chance by doing CPR. CPR can, I don't know who teaches CPR in Chennai, but if you have an opportunity, get a certification, get a good teacher and learn CPR on, there are good dummies, you know. And if you do well on the CPR, you can do advanced CPR certification, where you can give drugs and all that. So please think about getting lessons in CPR. And this is another controversial, that is my opinion, not on guidelines. I think anybody with heart disease or any big gathering, you know, a big shop or a stadium or a temple where people gather, you should all have AED, automatic external defibrillator. You have all seen this in airports. Expensive. But in the scheme of things, in the business that somebody does and how many people it can help. It is insurance to save a life. You don't know how many times I've seen patients who have been shocked by AED, brought to the hospital, and they live for another 20 years. It's a simple device. It is intelligent. You hook up, it tells the rhythm, and it shocks on its own. AED, I don't know, in the US it's about $2,000. It may be, generally things are a little cheaper here. No. Anybody can do AED. But you have to,
Gadget which is attached to the
yeah,
body.
it is like it's a box. Suppose you have to do drills for that. So you pass out, no pulse, he's dying, hook up, the computer will read the rhythm and shock. Hopefully you don't use it, but you don't know when you're going to use it. I've recommended people who have had bypass surgery to buy one and keep it and test it every month so that it doesn't go out of. They say, some people say, it's very expensive.
It's big colonies like ours and all, we can have one for the colony.
Yeah.
Where, it can be used for anybody.
For big colonies, you need to have a special device in your in your iPhone, emergency, so-and-so place. Your group of people should go, do a basic CPR. Other person should get the AED and shock. You save a life. Cardiac arrest, I didn't talk about cardiac arrest. One of the manifestation of heart attack is sudden death. Even though you can die in sleep and all that, very people can die, and we have chance to save that person in the first 2 or 3 minutes. The brain can sustain with CPR about 5 to 10 minutes. By the time you can shock and get him out and save a life. We have done it because this is electrical storm, heart attack can manifest in different ways.
When was this introduced? AED?
Oh, a long time back. What? 15 years back.
But how come none of the doctors here prescribe to that or even suggest that vaguely
Because
in heart patients?
I don't know why, because of the expense, and the patients may not know how to use it, but it's trainable. Now things are so easy now. It used to be bulky and unfriendly. Now it is like a computer. But you have to have drills. If you are living in a community of flats, every second month on a Sunday afternoon, people should have a drill. And the drill, you should not even know when the drill is coming. You have to test the system. Then you'll know who's showing up, who's not showing up, Just like a fire drill. You don't know when the fire is going to happen, but you do fire drills. So AED is not generally, because it's expensive. So the general public, the health organizations don't want to panic the people you should have it, because of the cost consideration and training required. Some training is required. But I, for one, feel everybody should have an AED, especially you have heart disease.
Very interesting.
Very useful one.
Yes.
There's one thing I want to ask. This heart attack doesn't lead to any paralytic attack and all those things, no?
No, if you have paralysis is different. That's a stroke. That is caused by a condition called atrial fibrillation very often. When the heart rhythm goes out of sync, blood clot forms in the chambers and form a clot. So that's why patients with irregular rhythm, atrial fibrillation, you should be on blood thinners. Blood thinners called Eliquis. So one other point, let me look at my notes. I might have missed one or two. So I went at random, all the important points, trying to cover a very big topic without the role of aspirin, it's controversial. If you have diabetes and your risk profile is high based on this, you should be on aspirin, provided you don't have an ulcer history. But if you are above the age of 70, you have to ask your doctor to make sure that you are not prone for any bleed. Point number 2, anybody with heart disease, heart bypass surgery, stent, blockages, should be on aspirin, unless you are allergic to aspirin, in which case there are other drugs called Plavix and Brilinta, clopidogrel. I don't want to give you all those names to confuse you. But aspirin is very important, is life-saving, even when you are having a heart attack. Suppose you are having a heart attack, you are calling your friend to go to the hospital. Take 2 aspirin and chew it. It will thin the blood, and there's a small chance this clot will dissolve. Small chance. So aspirin, statins. I know you asked a very important question. Many people think LDL is not important. It is very important. Keep the LDL low. Coronary calcium scan, I told you. Management of diabetes, totally a different subject. Multiple new drugs have come, and which is, yes sir. Yes, there are chewable aspirin available.
Apart from the normal one,
Yes, yes.
how do we differentiate? When you go to a pharmacy and ask him, is it available?
It should be available. Chewable.
Ecosprin?
Yeah, there is.
That is the trade name.
Yeah.
Sprint is a tablet. Yeah. It's not a chewable tablet. No, you can chew it.
You can.
Globulin less effective than Brilinta.
No. Clopidogrel is more effective than aspirin.
Yeah.
It's antiplatelet.
Somebody who is allergic to.
Then you can take clopidogrel or Brilinta, 2 drugs.
Sir, in India, Ecosprin is given as a blood thinner.
It is not. It's a blood thinner.
Given by cardiologists.
Yes.
My doctor Chokalingam told me.
Yes. It's a blood thinner.
Yeah.
Normally they take the international blood ratio, something like that.
That is only for warfarin. That's another kind of blood thinner. Coumadin.
Oh, God.
That you give for atrial fibrillation and valves. Here we are talking about aspirin for
Like
heart
blood
attacks.
clot.
Yeah.
An asthmatic person, how much are they prone to heart?
No, asthma can stress the heart. If you have a severe asthma, the right side of the heart will try to push the blood against high pressure in the lung. So indirectly it can cause heart failure, but not a heart attack per se.
Talking of diabetes, earlier days people were talking of 150 as the level above to which you can go. Suddenly it was brought down to 100.
Yes, it was all.
Sudden change.
Because of more data, more.
Or because they were wanting to sell that.
No. I know what you're saying, but diabetes below 100 testing.
You want to ask him something?
Yeah. And could you say the reversal of the numbers possible just with the lifestyle modification?
Yes. Lifestyle modification, exercise, diet, keeping your cholesterol low with diet, and preferably with statins, your blockages can come down 50%. It has been shown. Lifestyle modification, even for high blood pressure, you can come off blood pressure medications if you change your lifestyle. If you lose weight, I didn't even talk about weight.
Yeah. I wanted to.
That's what I had it in my notes. I knew I forgot something. You know how it is. You know that you have forgotten. You don't know what you have forgotten. Weight is a very sensitive. I once described a patient in my notes in US, 40-year-old obese female.
What is it?
Once I described a patient, 40-year-old obese female comes in with chest discomfort. There in US, they have access to your notes, internet, what you describe. Next day she calls me angry. How can you call me obese? I mean, it's like calling somebody fat. Obese is a
softer version.
How can you call me obese? You insulted me on the paper, and you better take it back. Madam, I'm very sorry, I just went by medical definition. They are so sensitive about weight. Suppose you see a friend after so many years, I would have weight pottana, he will not take you, he will avoid you. If you tell him you look so good, see, weight is a very sensitive, but coming to the weight, waist, I shouldn't talk about, I have a big waist, but any 38, I don't know how many centimeters, 38, more than 38 inches for men and 34 for female. I don't know, don't tell me why. It is a risk for heart disease. It's called metabolic syndrome. High waistline, high triglyceride, and high blood sugar. All this this is a common syndrome called metabolic syndrome.
There's no age factor to this?
No. So, some people don't like that, metabolics. This all, is changing, but waist is a indicator because it has been shown people who have belly, the fat in the heart also is more. There is a correlation.
Is there any study like all heart patients invariably happen to be diabetic?
No. You can have a family history, genetic I told you, without diabetes, with a sudden death at the age of 30. You don't have to have diabetes to have heart disease. You can have some people don't have any risk factor. I've seen healthy athlete, fitness, sportsman, good blood pressure, good cholesterol, no sugar, die suddenly.
Can I share something with them?
Yeah, come. This is
Ladies and gentlemen, my name is Kamakoti. I am Sriram's classmate. Know each other for 65 years. I was what he described just now. Sportsman, athlete, fit, no sugar, nothing. At the age of 2010, I had discomfiture. I was not able to climb stairs properly. I had this problem. Went to the doctor. He checked me, nothing. I said, no, I have a problem. My son was getting married the following year. He said, okay, do a treadmill normal, ECG normal, everything normal. Then I said, nothing doing, I must see a cardiologist. Went to JSN Murthy in Dr. Ramchandra Medical College. I insisted that he should do a angio. Revealed 3 blocks, 2 major, 1 minor. Went through the bypass surgery. 7 years later, I had a similar problem. Went to a cardiologist, suggested 3 stents. Ultimately, he put 2 and he said 3rd stent is not possible. I am still continuing with that problem. If I run, I develop a chest pain. If I walk stairs fast, I develop a chest pain. It was Sriram who suggested that you will have to live with this problem, but you will have to moderate your lifestyle. So everything is possible. This is not something that you develop over a period of years. It comes suddenly.
Very well said. It's a silent disease, and you hit a cliff and you fall.
I have a similar experience. I had a similar experience. At the age of 66, I had I feel little discomfort. I thought something's wrong with my stomach. But I went and checked up, everything was okay, ECG, everything was okay. Then I did a 360-degree scan. They found out some mild blockage there. So they put me into angiogram. They found out it was 70% block. but it's a long passage. So I they put a stent. After 7 years, I felt while walking, I felt there was some choking in the jaw. So again I got admitted. They checked up, everything was okay. Even they did echo also, nothing was there. The next day they did an angio. They found out it is 70% block again. And there are 2 blocks. She said, I'll give you medicine or I'll put a stent. The doctor is a lady doctor. So I said, if there is time, we put a stent. So I had two stents there. That was at the age of 73. Now I'm 81 now.
Good.
But I don't know, you have not described anything further. What things I should take care henceforth?
So, this is, so we should get you to at least till 95. So many things we can do. Make sure your LDL is below 55. Your blood pressure is at least 130/80. Make sure you take aspirin if you are allergic to aspirin, clopidogrel or Brilinta. Yeah. So every 2 years or every year, go through a treadmill to see if something has changed. And then sleep well, don't get stressed, and pray intensely.
No, I walk for 1 hour every day.
Yeah, good. That's a very good sign.
Doctor, I have one thing. Fatty liver,
Yeah.
non-alcoholic fatty liver,
Yes,
hereditary. Its implications on heart diseases. I mean, is it the same thing that what you're
No direct correlation. No direct correlation. Fatty liver is a very common problem now because of high. It can lead to cirrhosis. It can lead to liver disease, but it has no direct correlation about coronary artery disease or stroke.
Doctor, the emergency dose packet of children, aspirin,
Yes, sir.
Prevention of heart attack, packet emergency dosage,
emergency, I mean, you can chew 2 aspirins and go to the competent emergency room hospital. That is, going to the emergency room is important in time.
Okay.
But you can take aspirin as you go.
Friends, doctor was talking about AED. I have this experience to narrate. At the time when I got my second stent going, I was in the outer ward of the operating theatre. I passed away. I was dead for 3-4 seconds. I think this is the machine which brought me back to life. I believe these are all very normal things happening in a theatre or outside the theatre. So this AED business, I didn't know that one could have it at home or something like that.
Yes, you can have it. You can have it at home. It's available. You can see it in the airports here.
Doctor, I was now there is a good cholesterol and bad cholesterol.
Yes.
Now supposing the bad cholesterol is not high, but the good cholesterol is low.
That is also a risk factor. I didn't go into it. A good cholesterol good cholesterol called HDL below 40 is a risk factor. Unfortunately, we South Asians, we are all cursed with the low HDL, genetic.
Genetic.
Yeah.
Genetic.
How do you increase?
Increase is exercise and some mild alcohol. 2 pegs of wine. Not arak.
This is the best part of your lecture.
Hello, doctor.
I didn't say that. I don't know if the conservative audience in Mylapore, I didn't want to.
We got the message.
Mylapore alcohol pesa mudiyadu. Yeah.
Doctor.
Caffeine has been suggested, especially coffee drinkers.
Yeah.
Caffeine, milk, caffeine. So is that, that or?
Coffee is good for the heart, but too much coffee causes heart irregularity. So if you have 1 or 2 cups, it is also protects against pancreatic cancer.
Doctor,
I underwent bypass surgery in 5 years before. At that time, the LVF was 35%. Even now, it is same, 35%. How to improve the heart muscle? LVEF.
Unfortunately, once the damage is done, it's done. So ejection fraction can be improved with certain drugs called angiotensin receptor blockade, like losartan and enalapril, things like that. There is also a drug called carvedilol, which improves heart function. But it is very hard to get it back to normal. That's why you should go and get your blocked artery open within 1 hour. Otherwise, the muscle damage is permanent. If it is less than 35%, again another number, too many members, I'm going to give you a test before you go. So any ejection fraction below 35%, you should have what is called as AICD, a defibrillator which is implanted in the heart, like a pacemaker. Same AED principle, they make a pocket, put a device, put a lead, in case your heart stops, it jump starts. The more prone for people who have an ejection fraction of less than 35%. Ejection fraction is a measure of what the heart contracts. Normal ejection fraction is 55%. That means whatever blood the heart left ventricle receives, 55% of it is ejected out normally. If it is 35% or below, you're more prone to develop cardiac arrest. To prevent cardiac arrest, you put what is called as AICD.
Nowadays, these youngsters,
Yeah.
they have so much of hormonal imbalance that they become obese even at 18, 19 years of
Yeah,
age.
yeah.
And because they are young, you don't see the symptom. I have some relation who's more than 125 kilos at 20 years of age.
That's a big problem.
Medically, nothing has been. So what do they do like that when they have?
First of all, we have to make sure there's nothing metabolic, like a low thyroid causing obesity, lack of exercise, genetic, diabetes. And these people are more prone to sudden death because they have sleep apnea. I didn't talk about sleep apnea, very important. I'll come to your question in a second. If you have too much drowsiness during the day, you feel tired all through the day. One of the causes is that in the night, you snore a lot and you're not getting enough oxygen. Your body is starved of oxygen. So, it is called sleep apnea. That's because your throat narrows when you sleep and you snore. That's why the first complaint is from a spouse who says, I cannot sleep because my husband snores too much. And if you get further history, the husband says, I'm always tired during the day. Sleep apnea is silent, just like hypertension, silent. Like blockages in the artery, silent. So you have to be aware. So sleep apnea is missed by doctors also. Sleep apnea. And another cause of fatigue is anemia. If you have a low blood count, you feel tired. So you should always get a hemoglobin. You may have a bleeding ulcer or cancer. So any more questions?
Does cardiac arrest lead to weight loss, weight reduction?
Cardiac arrest? No, cardiac arrest doesn't lead to weight.
Blood thinness?
No. Weight loss? No. Unless you're talking about a severe heart failure, there's a condition called cardiac cachexia. You're not able to absorb the food because of heart failure, then you can lose weight. But that is so extreme that is very rare.
I'll share my experience. In fact, 6 months back, when I was on the way to Chennai, 200 kilometers before Chennai, I developed a chest pain. Within 3 kilometers, we saw a hospital on the way. We went there and they saw us. They took a ECG and they said, maybe a gastric problem, you don't have to worry. And they put some antacid injection or so. By the time the pain was subsided, so we started driving again. again it culminated to another pain. Next to hospital, which I saw somewhere closer to Mahindra city, I went inside. There I was there for an hour. They were doing 2 UCGs, and there also they said it could be a gastric problem. So I was there for an hour. After that, I felt all right. Then I was moving towards the city and got into Kaveri. The moment I got into Kaveri, I was collapsed, and my pulse went to 374, then it went to 0. Then they did CPR, and they did AED, and they brought me back, then they put a stent. And in that process, I lost about 12 kg weight. And this is almost 6 months. In the 6 months, I gained only about 2 kgs. That's why I just asked.
Your appetite has gone down, or?
I'm a bit conscious in eating.
Yeah, I see.
So that's other.
I would not say it's a direct correlation.
Okay.
I mean, one of the problems with cardiac arrest is mentation. Because when you have no blood flow to the brain, people recover, but they get very slow. But you seem very too sharp for me.
You can very answer my own.
He was in Brillianta, all those, and he had a
Brillianta led to internal bleeding.
Yes.
Then they changed to, I mean, of course, I underwent an endoscopy, and they changed it to clopidogrel now.
Clopidogrel. Yeah, it's a good drug. But don't, I mean, I'm not your doctor, but I would not stop it with your history, you know, because this is called malignant. Even you nearly died.
Yes.
So you need to use everything under your power to keep your blood thin, you know. Because if this happens again, the same thing, you are going to behave the same way.
Okay.
You know? And you are a good candidate to buy a AED.
Okay.
And train your...
In fact, we started an initiative in our society. We did the first CPR training for about 24 people.
Yeah.
We are now discussing about having
Good.
a AED.
You should share your experience with other groups. I mean, your experience and your success will lead to more successes. Other than we giving a talk, you know, what are the hurdles, how to overcome the hurdles. You know, your experience means a lot to the other societies.
With your permission, I would like to share only one thing with everyone is, even if it is a false alarm, no problem. If you find some chest discomfort, go to the nearest hospital. Yes. Let 100 alarms be false alarms.
Yes. This is what I also alluded to.
Yes.
Don't hesitate. We all hesitate to go because we don't want to draw attention. You know, that's our nature, right? It's okay to wake up your spouse or your son or your neighbor, tell them something is not right. I mean, they would not mind. Same thing, I mean, we are all living in a society of, you know, helping each other.
True.
Nobody is going to say no to you.
Thank you for this wonderful session, doctor. It is very useful.
Thank you.
Doctor, I have one instance which I don't know how it is relevant. My father-in-law, he was at the age of 75 or 76, he had an instance of heart attack before. And then one Sunday morning, he said he went for a walk and he had a fall. And then he was taken to the hospital. He was taken to the general hospital because it was on a Sunday. And the doctors, everybody came, and the doctor said everything is all right, excepting there was an intern who felt that he is having an attack.
Yes.
We as family members felt that he was having an attack.
Yeah.
Because his whole body was all right, but he was sweating on his head. When he had his first attack also, his head was sweating because he was bald, we could see, and he was sweating on his head.
That's a big sign.
And but the doctors said, no, everything is all right because his ECG was normal, his blood pressure was normal, everything was normal. And since we went on insisting, they told us they took a blood sample and told us to go to Hinduja hospital because that hospital did
Bombay.
not have.
It's Bombay.
Yeah, in Bombay. So they said that if you go to Hinduja hospital, they will do a culture test which will take about 2.5 hours. Some test.
Troponin.
Some test.
Yeah, I know. Yeah. Troponin.
So they told us culture. So that test, and then we will know that whether he has an attack or not. But they denied the fact, you know, that is something which I still live with it. And we got the test and it was saying he had an attack. And by the time we came, he died.
Oh, very sad.
So,
I mean, that's very sad because the rule of thumb for practicing doctors, patient is always right. If the patient says something is not right, even though you are not able to explain, you will have to assume, and it's a fact, that something is not right. So you have to admit and do all the rule out. It's called triple rollouts. 3 things can kill you: heart attack, pulmonary embolism, and ruptured aortic aneurysm. 3 things can be silent and masking, pulmonary embolism, blood clot, especially long flights, long car journeys, short of breath, pulmonary embolism. Heart attacks, we have been talking for the last 1 hour. Another is ruptured aortic aneurysm. I didn't talk about it. Long-standing high blood pressure can lead to aorta getting dilated. And if it is beyond 60 millimeters, it ruptures.
Correct.
And very often it is fatal. But very often, sometimes you can save them if you get them in time by doing surgery. Triple rollouts, we do that by doing a CT scan. So your father-in-law should have got unfortunately, there is no accountability among doctors. There is no mortality review. I don't know how it is now. I left India about 45 years back. There, every death is scrutinized by a third party. If I did something wrong, they'll come and tell you, you should have done this. I learn. They share it with the family. If it is gross negligence, then I'll get sued, which is right. If I do gross negligence, if it is minor, then it is acceptable within the standard of care. Do you understand what I'm talking? But this, of course, I don't know the whole picture, but it keeps you, the more I am doing cardiology, more humble I realize how much I don't know. And more humble I get. When I finished my cardiology training, I thought I was super good because I was so good in my textbook. Then I realized I don't know anything. Long flights.
Can they take long flights
Yes.
to other countries?
Yes, yes.
Of course, it depends on the individual
You
condition.
have to keep your legs moving.
Okay, but
That's pulmonary embolism. I see at least once every 2 months, long flights. You develop blood clot, legs get swollen, and you get short of breath. You need to do a CT scan and thin the blood. So pulmonary embolism is as bad as a heart attack.